Good morning, everyone. I'm deeply moved by the presentation of Dr. Dolphin Colin Vagina. The experiences and the research study she shared with us, my experiences with the diverse community tells me that it is same. There is nothing different what Dolphin has shared with us this morning, which is not happening within the diverse communities as well. But in addition, there are more barriers for multicultural communities in Canada. And those are, we all are very well aware, is the lack of the knowledge about the system, and also language plays a biggest barrier. So thank you, Dolphin, for sharing that research study with us, and it has opened our eyes about those child sexual abuse issues. But what I am going to do now is walk you through a journey of Punjabi Community Health Services, the organization where I work since 1994. And also, at the end of the presentation, I am hopeful that the 3 points which Minister Puller raised about the prevention, healing, and friendly criminal justice system, of course, it is within the hands of the system, but the prevention and healing is our responsibility as a community. And how to work within the diverse communities, I'm hopeful you will have some tips before you leave this room. Okay, I hope I have to use this to move on to next. I should have asked Robin before she left. Okay. Oh, yes, I am right. Okay. So the grounding principle of community engagement. Canada is a wonderful country, and there are many systems set in place, and everything runs on system. Working with diverse communities is a challenge. And now the question is, what are the grounding principles? Of course, there is a challenge, and we like to involve our communities. We like to serve them. We like to provide the services they deserve. But the principles are, people have wisdom. People can be empowered to bring about change. And people know 3 things. They know the problems, they know the solution, and when to take action. But what is the challenge? The challenge is professionals often contradict these because of their conflicting priorities. I know this statement is kind of, we are professionals, we are here to help. But what is the contradiction? And here I see, how do we know professionals' contradictions? It's about their funding bodies. Each funder has their own guidelines, and as professionals, we are mandated to report within those guidelines. And there are agency mandates. And I can share you example of agency mandate. I work in Toronto for over 25 years in the health service field. One of the agency mandate, to serve, the client should come to you. You can't go to client. And if a client is a newcomer and has a transportation barrier on top, language barrier, now your agency mandate says, no, you can't make a home visit. So it doesn't mean that professionals or healthcare providers, we don't want to provide the service, but it's mandated. And we are supposed to, if it's mandate, it means it's mandate. And the professionals' attitude towards what is best for the community. And there are many research studies are conducted which we decide, okay, as professionals, yes, we like to do needs assessment first, what is best for the community. But on the other hand, we say people know what their problems are, they know the solutions. So that's where there things, the contradiction comes between the priorities of professionals. Another good example of like within Toronto, what I have seen is that there is heart disease is very popular. And South Asian community is #1 within the heart disease issues, and now diabetes is becoming another problem. And there are many research studies are conducted, and those all results tell us, yes, it is a challenge within the South Asian community and diabetes within the Black community, but still the research studies continue. I guarantee you, you need a full-time one-year job to read all those research studies, and there will still be more research studies, and we will continue to do research studies. But the question is, what is that we like to do? And majority of the models are deficit-based, and there are very few models which are community development-based. So what do I mean by this? The community development is two types. When you want to work with the community, one is, are you working for the community, or you are working with the community? For the community is a very good example. Yes, we have received funding to do a pilot project on what are the parenting barriers, for example, within the diverse communities, or how to address the child sexual abuse issues within the multicultural communities. So this is a pilot project. Now, you hire a coordinator, you do the needs assessment, but on the other hand, if you work with the community, they can tell you, yes, these are our problems, these are our issues. Does your agency mandate meets our issues? Like, you have wonderful resources, but do you agree, or are you ready to make those little changes where you can go where the community is? Or you are open 8:30 a.m. to 4:30 p.m. And my friend just said, I am not on Indian time. And if the culture, you're talking about South Asian cultures or within, where time is fluid and there is no concept of time, and then you say, no, we are open 9 to 5, but now your clients can come and see you after 5 p.m. Are you available for those? So those are the little things which actually community engagement and working within the multicultural communities we can think about and take home, that are we ready and willing to make that change? See, technology is so wonderful. I have one, and I have two, and I keep forgetting to show you where I am at. Okay, this is the one. Okay. Yeah, now we are on the same page. So how do we know that professionals often contradict? We talked about it. And another thing is, so making inroads within the diverse communities. So my role is that I cover how you can work within the multicultural communities. So the first one is, if you find out what is the end goal, so the end goal is determined at the end. But in order to work within the diverse communities, and it is my experience, which I will share with you down the road while we progress in my presentation, that when all is said and done, what would be better for the community? And would the community be more empowered to make decisions which affect their well-being? And or the community control the process and the outcome? Or would there be something to show after the initial engagement? So all these 4 points, I can see that in the journey of Punjabi Community Health Services. When we started, it's been next July will be 25 years. And when we started in 1990, and that has, I have divided it into 5 components. So the beginning years, the end was clear. There was a participatory action research study was conducted, and it took a good 5 years. But it doesn't mean that we waited for the recommendations, which is a normal process when you start the research, that you wait for, okay, what are the findings and the recommendations. But on the one end, you say, yes, the community knows what the problem is and what the solutions are. So we started working for the community at the same time within the 1990 and 95. Those were our research years, but same time, also the years when we started responding to the community's needs. So what was the community's need? Back in 1990, a group of individuals came to when I was working at the PL Public Health Department, and my colleague, who is also the founder and chief executive officer of Punjabi Community Health Services, Baldev Mutta, community came and they said, and those were the senior members of the community, like the older adults, they said, as a result of alcohol abuse, the family breakdown and the violence issues are increasing in our community. As a public health, do something about it. But now the public health wanted, oh, it's only 5, 6 individuals who told you about this, but do you know, is there evidence? Is there a research? For being in the system, we started the research. How the research was started? Yes, there was qualitative research, quantitative research. We all are very well aware of all those nice research processes. But in addition, we actually work with the community where community was. Knowing the fact that our community is not a community who documents, community doesn't like paper and pen, so how can you say, okay, here are the questionnaires, please fill this questionnaire so we can do our data analysis and find out and make recommendations. So we hired community members who were actually going on the bus stops, and now we want to know, is alcohol abuse resulting into family breakdown issues? So we were actually talking to the people who were on the bus and willing to share their experiences, becoming friendly with them, same time completing our research, both qualitatively and quantitatively. So, and also at the same time, the end was clear that we need to do something about it. So we started a men's group program. And it was said that there are many services available for women and children, but the men who need the help. So we started, it's still up and running since 1990, the Sahara Men's Group Program, which deals with the violence and the substance abuse issues simultaneously at the same time. So it was started in the basement of our founder and chief executive officer, because there were no other means and resources. And the next 5 years were our struggling years, where we were thinking, we compiled the report, but there were no means, the resources, the funding resources, and it took only 18 years before Punjabi Community Health Services received funds from the Ministry of Health and Long-Term Care. And it was 2008, so since 1990, to 2008, so it was 18 years. And then we have those maturing years from 2001 to 2006. And then we have a tremendous growth in the next 5 years, and now these are our sustaining years. But the end was very clear, and the people who were started the participatory action research, they become the board members. It was started as a Punjabi Community Health Project, and then it was formed as an agency, Punjabi, which is today is Punjabi Community Health Services, started from a car trunk, 2 basements, and now it has 3 locations where we operate on different programs. It's addictions, mental health, aging at home, and then parenting, of course. Another thing, what we have learned over the years, that the sensitive issues like HIV/AIDS, homosexuality, or the sexual abuse, those are very sensitive issues. You just can't go straight and say, okay, we are today talking about what is sexual abuse. We know that it happens in every community, and it does happen in my community. But what we started a consistent parenting session, and it's called Sahara Parenting Session, which runs every Monday, 6 to 8 p.m. There is consistency. There is, even though it's a long weekend, the group program is there. because this is how the community functions. If you want to work, how to work within the, want to know multicultural community, and my experience within the South Asian community, the community don't like calendar and or the schedule. But if there is consistency, and in our experience, it turned out very good when you say, okay, every Monday, 6 to 8 p.m., this is the address, and you need to go through screening, because screening is important, consent is important, confidentiality, Canadian legal system. So we respect all those, because those are our funders' guidelines, and also, same time, respecting how community functions. So the community building process in 1990 started with the Punjabi Community Health Project, and then we formed the organization. Agency is formed, and now the programs are up and running. But the end was clear that, yes, there is an issue in the community, and we need to do certain programs which are now culturally appropriate, and over the 20 years of experience led us to develop the integrated holistic service delivery model, which we will share with you this afternoon, how that model works within the South Asian community. And now, get to know your community is important. So the epi profile of the community and the community needs assessment and the research inventory. So all resources were combined, and everything was said and done. So then, after doing that, what is the audience prioritization? Does the audience, we completed the research and it is another document on the shelf, or we did something about it, and then it wasn't ended there. In order to complete the community building process, the prioritization of intervention was also taken into consideration. So it was very easy and to follow, okay, when a client comes to you, you complete the questionnaire, you complete your intake forms, but that's what not your client's prioritization. So then the intervention was adopted what the client's prioritization was, and that was the cultural aspect. That's listening to the story and completing your forms after listening to the client within what comes out of the client's storytelling process. And then another challenge we experienced, who is your primary client? Is the client who actually has the problem, and you have the database to enter that, or the client is the family is your client? So what we learned over the years, that we see family as a client, not individual as a client. Because within our addictions and mental health work, the person who has the issue, who is your individual primary client, is not willing and ready, but the family members he or she is surrounded with are more concerned, and you have more interventions with family members to educate the family about how to help the individual who is suffering. So in order to work with multicultural communities, it doesn't matter it's a South Asian community or Chinese or Philippine community, this model has worked very well with us. We know through the different statistics what are the demographics of the community. It's very easy, and in today's society, it's readily available. You just Google it, you get the demographics of the community. You can say, okay, these are the cultural issues, socioeconomic, behavior, access to services, specific audience, what are the resources available, and the community sport interventions. So it's easy to learn. So if we look at, we know if the food, different cultural foods, easy to identify, the fine arts, the literature, the drama. The first tip is very easy if you look at, it's divided into 3 parts. The first one is very easy. You can look at the person and you can make that assessment. Now the second part is, how does different cultures behave? Like, for example, the eye contact. You might have experienced in your clinical practice that some of the clients, if you happen to see from diverse communities, they may not make that easy eye contact with you. Sometimes we feel, should we shake hands? Or we do our best to go through the cultural competence trainings and learn how to work with different cultures. So those are very easy, and you can learn about those. The difficult part is knowing your community when you actually work with the community. What is the, say, motions of modesty? How do you judge a person? Do you look at the person and will say, okay, this person dress up nicely, or different ways how the person looks like? So you just can't judge. So I can share you one example. When I was on the airport yesterday at the Toronto airport, there was a Sikh gentleman, and he has a bag on his back, and I was waiting in the line, and behind me there was another gentleman, and he crossed with the bag, both of us, between me and him, and he hit me with his bag as well as the another gentleman. So because I am from the community, I have best of both countries, India and Canada, so I'm more Canadian and less Indian now. So I know that wasn't his intention at all. But the another gentleman was very upset, and he made a remark which wasn't appropriate, but for him, it was. He said that, oh, you have a turban and you are Sikh, it means that the line will run fast for you. Then I was thinking, this is not his fault. His culture says, if these things happen in rush, you will say, oh, I am sorry. Then the things settle down. It doesn't mean that Sikh gentleman who was there and his bag hit both of us had no bad intentions. He had a long flight. I don't know where he was coming from. He had no language. He was waiting for which line I should go. So he had so many things going within his mind. And he did that, and then when I looked at him, then he said, had very limited English, not to me, to the other gentleman, oh, I'm sorry. So then I was thinking, it's not that this person knows that how you look like, it's very easy, what actions you performed, but do you actually understand where this person is coming from? Or what are the intentions of the persons? Sometimes we say, oh, okay, in anger you say certain words, but don't go after the words. In order to make it, I will say, go after the intentions. So there are many different challenges. So in order for us to work within the multicultural communities, it is very important for us to know the community. And how would you know the community? When you work with the community, not work for the community. So now working with the community and creating a sportive environment is important. So can agencies work towards the well-being of clients So we have mainstream organizations, and then we have ethno-specific organizations. So can we look at different approaches, family-centered versus individual approach? Uh, is peoples from diverse communities or people who are in crisis or need our help, their expectations, we should not get a voicemail. When we call in for help, we should get somebody to speak with. Or should the client come to the professional to seek help? Or our agency mandates, we can also decide professionals can go where the client is, or what's the most comfortable environment for the client. So this is something to think about, especially when you are working with the sensitive issues. It's very easy when you are working in say, in Ontario, we call it Ontario Works, where people go for social assistance. I'm sure there will be different terminology for this in Alberta. So they come to us, and because you need to photocopy their SIN number or want to make sure your complete documentation is complete, so client comes to you. It works. On the other hand, when you're talking about healing or providing support or wanting to make someone opens to you, and so that you can make the assessment, make appropriate referral. So is our agencies are ready to make professionals go where the community is? And there could be another intersectoral approach. The community development brings together many sectors. So as we said, since morning we are listening, and there are many things are outlined about the system, about the professionals, about the individuals who need help. So this intersectoral approach is important. We have minister with us today. Minister alone can't do it unless community is ready, or we professionals are ready, and we are also willing to acknowledge and recognize, yes, we live in Canada. Canada is a land of multiculturalism now, and there are different communities, and those communities' needs are same. As outlined in Dolphin's presentation, all those barriers to seek help are same. And in addition, multicultural communities has additional barriers. So what has worked within the Punjabi Community Health Services, and the secret of our success, is the intersectoral approach. Learning about the Canadian system, learning about the legal system, learning about how ministries works, learning about how different funders work. Everything is in place. Now you receive the funding. Is your agency ready to make and adopt those changes to accommodate the needs of diverse communities? So if we combine all those 4 components, then the results are better, and this approach works. See, another thing is the partnership. I don't know how it's happening in Alberta, but in Ontario, all ministries are now looking at collaboration, integration. So those 2 things, wherever in meetings we go, are the key discussion topics. So the partnership is very important, but is partnership based on equity? Or in partnership, you see there are one person is receiving the funds and other is doing the work. One is controlling the work outcomes and another one is controlling the funds. So then it does not work. But if our main goal is how to serve the multicultural communities, you have the different set of expertise. Community has different set of expertise, and if you agree, yes, we have different set of expertise, and this is the issue in hand which we like to address, then the equity is very important, and everything must be transparent, and task and division of work, it's important, and that's where we have all those wonderful steering committees and working groups which works, and let the diverse members take the lead. what do I mean by that? If we make inroads within the community, and I can use the example of South Asian community with you, if there is a buy-in from community stakeholders, say for example, you like to take and work on a project on child sexual abuse. So it's a very sensitive issue. How would you approach? How would you do that? Either we talked about media and training of professionals, and in addition to training of professionals, I would also like to add the cultural component. How would you address? So in that case, the community takes the lead in terms of if we have the community stakeholders have buy-in, and the person who has the most credibility in the community, if we find those individuals and align with those individuals, then our work will become easy to work within the multicultural communities. Now, reorienting the programs and services. So that's something I have touched in the beginning as well, and that's the biggest challenge we experience within Ontario, that our programs, our services are wonderful and amazing, but in order to accommodate the needs of the community you are working for, are you willing to reorient? Are you willing to adopt what the community actually needs? So the timings of the service, like especially for the immigrant population who are struggling and working different and odd hours to meeting their ends meet, and same time they have an issue and now they know where to go seek help. Is your agency mandate is to open your agency after hours or over the weekend when actually communities are available, or make your staff available to go when the client is available? So those are some of the questions we can think about. And another thing is transportation also becomes a biggest barrier because you don't have driver's license or car on very first day. So if the service you like to access is at a distance, so we also say that, okay, we will provide you the transition cost, or we call it bus tickets or tokens. So is that enough? Or if a mother who needs your help and in violent situation, and now she has 3 years old and 1 year old, and now she needs food, we'll say, okay, our food bank is open 9 to 5, you are within the catchment area, now she has no means to come to you. So how the food get to her? Is she coming to you and getting the food? Or as professionals, we are creating a means and we are reorienting our programs so that if the need is identified, that how the food get to mother. So these are certain things which we learned over 25 years, the work within the Punjabi Community Health Services to meet the needs of the clients or keeping the professional guidelines in mind which are already identified by our agency. So how would the violence against women be handled within the Caucasian community versus in the South Asian community? We admit that this is an issue, so those are the certain things we need to think about, and we need to address if we have the different clientele, and we understand that say for example, the violence need issue is the same, but the service delivery, that is where the question comes to serve the multicultural communities. Are we using the same programs and the same learnings which we have learned from a Canadian university? Or we are making adaptation learning about the community and how community would seek help? And I can share you a very good example. We had a Bachelor of Social Work student from Ryerson doing placement with our agency. And when our client comes and we do the assessment and develop the care plan, on her very second week of placement, and she said, oh, I need to book an appointment with you. I said, okay. Her first thing was, oh, your case manager who is assigned to supervise me doesn't know how to write the care plan. So I don't know what I'm gonna learn. In my social work class, I learned this is client's care plan. This is how you write it. And that was definitely, her concern was valid. She learned, she said, when you write the care plan, it should start with two to assist the client in this area. But our CARF mandate says it is client's care plan. It is not your care plan. So that is a challenge. Are you working for the client or you are working with the client? So she was right. In her practice, what she's learning is good, but how our case managers are trained, they are not only supportive counselors, they are also teachers at times, they're coaches at times, they become mentors at times, and sometimes when client comes to you, they ask you to disclose, oh, where you are from, where do you live? So we know as professionals, we are not supposed to disclose, but now your client who feels say, okay, I have built my rapport, I need to know about my counselor knows about me. So question is, where do you draw the line? And that is the tricky part when you work with the multicultural communities. Same times you don't feel like offending your client. In last 5 visits, you just are coming close to you build the rapport with the client, and now you say, no, I am not supposed to disclose that. So that is where that diplomacy and working within the diverse communities come in, and that's how our case managers are trained to help clients. We know that let's prioritize clients' goals, but the goal is defined by the client. And one of our clients, when he had addiction issues and he came to us, I would say, okay, what is your goal? And he said, what is goal? The definition was goal to given to him, explained, it took another half an hour, and he said, my goal is to go back home and paint my home. So this is his goal, and he actually did it. Does it have anything to do with drinking and driving? Not at all. But was he educated same time? Look, you have, this is court mandate. What is court mandate? You are supposed to complete 3 weeks addictions day program, and he did. So while working and providing him what he is required in order to meet the legal system requirement, also assisting him to develop a plan to go home and go whatever your goal is. So simultaneously, that's where when you book an appointment, and if you are under the pressure, okay, I have half an hour to see the client, 15 minutes for my documentation, 10 minutes to enter the information in the database so my system can produce the report and my supervisor can see I have completed everything. If you are limited to that 1 hour, then we are not doing justice to a culture which is a storytelling culture. So one of the reorientation of the programs in our agency is our case managers have 2 hours when they have a client. The 2 hour becomes hour and a half. That's wonderful. Sometimes 2 hours become 2.5 hours because your job is you are sitting with a person. You are not working for the person. You are working with the person who is now has issue in hand, has come to you because he is caught into the system. He has to complete certain requirements, but your agency mandate will do the service, but not the justice. So that is the key point when you are reorienting and making your services for your clients. So addressing the child sexual abuse in the Punjabi community, so there are two streams of thoughts while I was having discussion on this topic. So let's not rock the bottom. It's not a big problem. It is a big problem, but it is not a big problem. People don't want to address it. It will give us bad name. Of course, we saw in Dolphin's presentation, we have other issues that are more serious, which require our attention. But we must address this and deal with the challenge. So how do we do that? And this is the model which help us to work on the sensitive issues like sexual abuse within the community. First of all, which recruit like-minded people. That's number one. Second, align with the media. Media is very important. We have a very strong ethnic media in Toronto. So is the media host willing to talk about the sensitive issue? And then narrow the focus of the work. You just can't say, I will deal with HIV/AIDS, homosexuality, all those sensitive issues in one sort. No, you need to narrow the focus, and community must buy in your focus, and community must be the doers. So this is a 5-step approach, which actually we have implemented in Calgary, and we have very close to register our organization as PCHS Calgary, Punjabi Community Health Services, where the South Asian community will receive the culturally appropriate services. And all these 5 steps were implemented to come to close. And it is work, yes, but it is a teamwork, and it requires all sort of people to come together to have the community, to empower our communities. So when you start doing that kind of work, and there are always challenges, and so it has 3 circles that you have people who do not like it. And there are people who say, okay, I'm gonna stand on the sideline, but I really like what you are doing. And there are people who are your well-wishers, and they really want you to take the step and lead. So in community engagement and in order to work with those, so these 3 individuals are need to taken into consideration. Now, coming back to this, making inroads into the diverse communities, what is our end goal? We need to produce that, get to know the community, creating supportive environment, and reorientation of your programming. So if we have these 4 things in place, then this puzzle will become, and you will be able to provide services to any of the multicultural communities within Canada. And you can also see that doesn't matter, is it a parenting issue, or it's a sexual abuse issue, or another sensitive issue, you can impart the education to the communities if you follow this 5-step model. And I would like to thank you, all of you, for listening.
We can take about 1 or 2 questions. I wanted to be able to give you enough chance for your break, but if there's anyone that would like to ask a question, also just know that Amandeep has got sessions, I think, in both first and second breakout sessions this afternoon, if you also want to spend some more time and learn more about this extremely successful model. There is a question. Okay.
Okay, my name is that on? Okay, my name is Jassim Al-Musawi. I'm the Senior Program Coordinator at Immigrant Services Calgary. I supervise a multicultural men program. And my questions for you here, how do we engage men and boys into the process? How do we get them be part of this process? Be part of the allies against sexual abuse, against children? And also, how do we engage community leaders and have them part of the process too?
Sure, this is a very good question, and our presentation is all about how to engage the community and how to have the community involvement. That's your question, right? So one of the very easy way to engage the community is to start any sensitive topic within the parenting sessions. If you, in my experience within the South Asian community, if you tell parents, okay, do you want your children to be successful in the future or go to university? I don't see and till date a parent who will say no. They will say yes. Okay, then come. And you create the platform which is comfortable and easy, and the parenting sessions. That's where you bring in the dialogue. And your second part of the question is how to recruit the community leaders. Right? So this is not an easy part, but definitely there is always one or two people who are your well-wishers. You see those three circles, there are opponents, and there are well-wishers, and there are people who sympathize with you. So in the process, when you have consistency, you will say, okay, such and such organization is there every Monday, this time, they are doing something good. Right? So then it will attract the community. Once the community is attracted, the community leaders will start coming in place who are your well-wishers. So it is a process. Community development, again, it's not 2 + 2 = 4. Right? It's a process. Many times you fail and sometimes you are successful, but it works.
Thank you.
Just one question more. The lady in the green.
Okay, nisto ka Ekana Soyaki. My name is Ganaki Mikesto. I'm from Siksika First Nations, and I'd like to thank Casey, Eagle Speaker, for honoring our nation today. I'd like to say, first of all, I really believe what you're saying is true. I think with First Nations people, we're in a different area where we're being continually oppressed. We're having people coming into our territory that don't even know who we are. Alberta government doesn't even recognize First Nations people in Alberta. And it's slowly working, I guess, towards their a positive thing, because they now are going to put First Nations curriculum in the provincial schools. But I'd like to say, we people that work within First Nations people need to know who we are, and this isn't going right. This isn't happening today. They're working for us, not with us. So I'm really thankful that you brought that up, because it's so important. And one of the big barriers we have is that our people are not recognized for who we are. As for yourself, you come into this country, you can speak your language. For years, we were oppressed. We were not even allowed to do our culture, our language. So our people were really oppressed. People don't even know about the Indian Act. People don't know about the residential school, which is slowly coming out. I'm a product of one of them. And how the effects have continually affected our people to today, and how we're oppressing our own people because of lateral violence. And sexual abuse, it's just another layer within our people that needs to be addressed. But we need to do that for us, like you do that for yourselves. But our own people are going through a lot of oppression. Suicide. We just had a young child die just recently that was within child welfare. That was killed, and because of lateral violence, and because of child welfare. These are ripple effects that are continuing to happen to our people, but people don't know our history, and they need to understand this is our territory, but yet people tell us oppress us. So I just wanted to bring that to the floor, and I'd like to thank you for your vision, and I'm hoping we do the same. Thank you.
Right. No. Thank you for outlining all these issues, my friend. yes, it is our time as professionals to now learn the difference and modify our practices to meet the needs of the particular communities we are working for. So it is now professionals' turn to work with the community to provide the culturally appropriate services.
Thank you once again, Amandeep, and to all the speakers and to all the listeners who are probably looking forward to the next few minutes, which is a break. Oh, there's another question? It's hard for me to... Oh, I'm so sorry. The lights
okay.
are right in my eye. I apologize. So one more question, and then we do need to go for a break.
Right. Okay. I just have a quick question.
Sorry.
I know that one of the things that is a struggle for all communities, every community, including mainstream community, is that it doesn't happen in our communities. So I'm wondering, Amandeep, if you can talk about the research that you did within your agency on sexual abuse a number of years ago, and even some of the incidents, examples that you found when you did the focus groups here in Calgary. Maybe if you could just talk a little bit about the prevalence of it in the community.
Right, so thank you, Danielle, for bringing this up. Yes, I was in Calgary with the Calgary Communities Against Sexual Abuse, working on the child sexual abuse issues within the Indo-Canadian community in Calgary. So it was a sensitive topic, but when the CASA spotted it, and when we worked very closely with the community came forward. So we had a focus group with women from the community and also focus groups with men from the community. And those two focus groups were very well attended, and the people were very open and willing to work. And as a result of a community development, what happens, the women's group started meeting once a month. So they met yesterday. So they have a set date. I believe it's first Wednesday of every month. So they meet 6 to 8 p.m. So what has happened, it's not that we fixed all the child sexual abuse issues within the Indo-Canadian community, but as a result of this building community capacity project, what has happened, and a result of those focus groups, that the community is now empowered. They have acknowledged and recognized the need, and they're very happy that there is a platform where they can talk about the sensitive issues. And I'm sure down the road, maybe in another 2 years and then 5 years, we will be talking about our success stories on sexual abuse issues within Calgary through the work we started in 2013.
Thank you once again. So sorry to cut off the questions. I know it's a key part of the day, and I really do encourage you to follow up with Amandeep for more detail. We're going to have a break now until 11.